Well, good night. Yours truly, Professor Dr. Dolphy Gilpin. I've returned and I'm on some medical topics here. I left out two field of medicine, not purposefully, precisely three, and all three of them start with the letter O. The first one is oncology. Second is osteology. And the third, one of the five senses, we call it olfactory. And I'm going to put olfactology in quote. I've never seen such a word, so I'm putting it in quote. The study of the sensory smell. So I'm just going to put that in quote to let you know that that's not really in the dictionary as such. But olfactory is in the dictionary. So we're going to start off with oncology, an intrinsic topic, a topic that when a patient is diagnosed with cancer, it brings on a certain amount of fear because of the unknown in the precise solutions to cancer. Over the years, we have made a lot of grounds in finding the solution to a lot of cancer. But once upon a time, when cancer was mentioned, it was like a death sentence. Cancer of the breast for a lady is a very feared topic, a fear experience even upon this time, even up to this time. So, oncology, and I'm just going to go through the basics here, because I've given up practicing the medicine since about 2010 or so, due to a very traumatic experience. I decided to leave it up at that, but every now and again I do some research and I do some revision and exercise and revitalize my mind and consciousness about certain medical topics. So here we are, oncology. And I'm starting off here with the head. And I went in the layman earlier, it's oncology. Start off with cancer of the head, neck, cancer of the head, neck, so we have head and neck cancer. So we have oral cancer. That's cancer in the mouth. Cancer of the mouth and lips and tongue and gums. So we call this now cancer of the mouth, tongue, lips, and gums. Oral cancer. And so we have oral, pharynx, oropharyngeal cancer. This is cancer of the middle part of the throat. The middle part of the throat. And the middle part of the throat is called oropharyngeal. So the cancer is called oropharyngeal cancer. So we have tongue cancer. And this is the most common form of oropharyngeal cancer. The tongue cancer, the most common form of oropharyngeal, oral, P-H-A-R-Y-N-G-E-A-L, cancer. That is the tongue cancer. All right, so we move on and we have hydropharyngeal cancer. Hydro, or rather hypo, P-H-A-R-Y-N-G-E-A-L. Hypopharyngeal cancer. Which is cancer of the bottom part of the throat. Cancer of the bottom part of the throat. Of course, if we had some pictures here, it would help us to visualize where and locate where these areas are. But in other presentation, we'll present diagrams, labeled diagrams. So we have next one, the laryngeal cancer. This is cancer of the voice box. Which is called the larynx, L-A-R-Y-N-X. Cancer of the voice box. And which contains the vocal cords. And the next one we'll have nasopharyngeal cancer. Which is now cancer of the upper part of the throat, which is called the nasopharynx. And as we come down, saturating this paper here, salivary gland cancer, which is cancer of the salivary gland. Cancer of the salivary gland. And this salivary gland, as you know, produces saliva, which is in local term called spit. So we're going to stop here for the moment with cancer, and then let me put a mark here we'll continue with cancer of the nasal cavity. Let's make full focus on this, because it was not focused properly. So we're going to take this up and we look at the various cancer here. The oral cancer, cancer of the mouth, tongue, lips, and gum. The oropharyngeal cancer, cancer of the middle part of the throat. The tongue cancer, which is the most common form of oropharyngeal cancer. Then we have the hypopharyngeal cancer of the bottom part of the throat. Laryngeal cancer, cancer of the voice box. The nasopharyngeal cancer of the upper part of the throat, or the nasopharynx, and the saliva gland cancer. And there we have it. We'll just make a note of that, and we'll stop at the saliva gland cancer, and then we'll continue on. We noticed that it wasn't focused, so we tried to give it a brief focus for the last year.